Thank you, everybody, for joining us today for the Health and Ethics Network monthly seminar. We're really pleased to be meeting again today. The University of Melbourne stands on the lands of the Wurundjeri and Bunurong people, and I pay my respects to their elders past, present and emerging, and acknowledge that land was never ceded. Thank you, everyone, for joining us. We have two fantastic presenters today speaking about the ethical challenges in the use of AI in healthcare and academia, and a topic that's of great interest across the community, and something that people are struggling to understand and to work through. So I'm really delighted to be able to welcome Professor Mike South and Dr. Julian Koplin. Professor South is from the Department of Paediatrics at the Melbourne Medical School at the University of Melbourne and holds several other key appointments. And Julian Koplin is at the Monash Bioethics Centre at Monash University. So I welcome you both very warmly. We're going to each of Mike and Julian will present for up to 20 minutes, and then we'll have about 20 minutes for questions and discussion using a combination of the chat and also putting up your hand if you'd like to ask a question. So I will now hand over to Mike, who's going to share his screen and his slides. Thanks very much, Mike.
Thanks very much, Paula. So I also acknowledge the traditional owners of the land on which we're all sitting. Yes, I'm a paediatrician at the Children's Hospital, as well as work for the Department of Paediatrics. And I was going to cover some of the aspects of the use of AI in healthcare, which is becoming a very hot topic for us. And then I'll hand over to Julian. So I could have perhaps titled my talk, should you be excited or concerned if your doctor is using AI tools when providing your healthcare? Because we are reaching that point where these tools are genuinely entering clinical practice. So how do you prepare for a talk like this? Well, the obvious answer is you go to ChatGPT and ask it to make your slides for you. So I put in a prompt to say, make me a PowerPoint presentation with 10 slides, dot point format, for a presentation to my colleagues about the ethical issues surrounding the use of AI in healthcare. And how did it do? It said, yes, of course I can. Well, I can't make your slides for you. I can help you structure the content, and below is the outline for 10 slides. Now, things have moved on. You can actually get plugins that will make the slides for you. So those of you who are in academic world and giving talks, I don't know how many of you have tried this as a starter for getting your presentations going. But sure enough, it gave me 10 slides, including a title and a conclusion, and covered most of the points that I would have dreamt up from my reading and grouped them very nicely. I'm not actually using those slides today, but it could have done a very good job for me. And at the end, it reminded me that I could add some images and graphics, and I really ought to make it appealing to my colleagues to maintain audience engagement. Thank you for that, ChatGPT. I suspect within the audience there's a fair breadth of knowledge about what AI is and how it might be applied in these things, but in very simple terms, it's computer software that mimics aspects of human intelligence. And the idea of intelligent or smart machines or robots and so on has been around for a very long time, but the term artificial intelligence was conceived in Oxford in 1957. Same as me, actually, but maybe that's too much detail. So, I mean, we're all surrounded by AI all the time, algorithms that sort of almost run our lives. A lot of it's on our phone, some of it's in our cars, some of it's elsewhere, but it's ubiquitous and it's now making its way into these areas of practice. As a paediatrician, I'm interested in the development of children's language. And I was told recently that in the US, the first word that babies learn statistically is the same as it's always been, it's mama. But now, competing for the second word that they learn is Alexa, because they hear this being said in their homes all the time. Pretty scary, I think. One particular form of artificial intelligence that we use a lot, and which I'm going to come back to later, is the one that helps us with predictive text when we're on our mobile phones. And you'll all be familiar with this. You start typing something, and it suggests the next 3 most likely words that you're going to type. And in a bit of black humor, if you type "Are you coming to Grandma's?", the next 3 most likely ones are house, birthday, and funeral. We'll come back to that. Different types of artificial intelligence. There's what's called narrow intelligence, and that's what most of the things that are being worked on currently do. They do one particular task, and they might do it extremely well, but they don't have flexibility to do anything else. So in my world, that might be generating a discharge summary when someone's been in hospital for several weeks, to condense all of that down into a short summary that could go to the general practitioner. It might be image analysis, looking at photographs of the back of people's eyes who've got diabetes to see, are they developing eye complications from their diabetes? It might be, as I've shown on the image here, looking for a tumor on an MRI scan. But these are very narrow tasks. They're things that we can already do ourselves, but maybe AI can do it faster or better than we can. Then just briefly, there's a concept of general intelligence, artificial general intelligence, a machine or program that is much more human-like, can turn itself to all sorts of tasks, adapt to new situations, think abstractly, reason, solve multiple problems. We're still a long way from that, I think, but people have different views about how long it's going to take us to get there. And then finally, somewhere in the future, we'll have this concept of super intelligence, where it completely surpasses anything that we can do, enabling it to solve complex problems that we can't even conceive of, create new technologies, as I say, beyond our understanding, the things that it might be able to do. But let's not get carried away. Let's stick with the simple, narrow tasks that we think it might do. Well, this is, again, in my area of medicine. Might be interpreting a CT scan. It might be predicting a patient who's in hospital is becoming unwell from a serious infection complication, something we call sepsis or septic, a serious cause of mortality in hospitals, something we try and recognize but can be missed. It might be taking a photograph of a patient and recognizing from their physical features that they might have a genetic condition. A long-standing part of pediatrics is a sort of pattern recognition of clinical features of children with problems and trying to label them with a syndrome. And that's what I've shown in this image here. I took this photo in August of a patient, and the very first syndromic diagnosis that the app suggested was exactly what this girl has, a thing called Rubinstein-Tavy syndrome, and it suggested that with a very high degree of accuracy. It gave some other alternatives, but it didn't think any of them very likely, and so it was spot on. And down here on the right, detecting skin cancer. Now there are tools which you can take a photograph of a suspicious looking mole or skin lesion, and in this case it said that mole had a very significant risk of cancer. It even suggests that treatment, remove it surgically. So that's more in the sort of analytic type of narrow intelligence. And there's also, and what's getting a lot of attention, is this sort of generative form of AI, where it can produce things. Now, a lot of the hype has been around text-based generation, ChatGPT. I'll show you some examples of this a bit later. But it's not just text. It can do sound, music, images. Just for fun, I went to one of the image generating programs and said, draw me a picture of a child using their asthma puffer, something that's an inhaler, something that's commonly used. Now, this is the picture that it produced. First glance, you'd say, oh, that's terribly crude. You know, it's not a very lifelike picture of the child, and the asthma puffer is upside down. It's not showing things properly. But just think, this generated this image just from those few words that I put in. It has no image bank that it can pull up and show this. It drew this de novo. And if I asked it again, it would probably draw a different picture. This isn't Photoshop or something else. Pretty amazing. And with a few tweaks, I'm sure we could have improved that a lot. And there's some very high standard images now being generated in using these tools. I want to briefly say something about how these things get trained. To be intelligent, you've got to be trained. You can't produce something that out of the box knows how to do these things. I'll cover the sort of concepts of training. So originally, these algorithms were trained by us trying to teach it the rules, how to recognize something, how to do a particular task. What are all the rules? And that could apply to something like playing a chess game. There are some very effective chess playing artificial intelligence tools that can beat anyone in the world now. So you just, they started by trying to teach them the rules of chess. That's sometimes called symbolic artificial intelligence, or is now called GOFI, good old-fashioned artificial intelligence, because things have moved on from there. But I'm going to use an example outside medicine, how you might teach a computer to recognize a cat. And here I'm drawing heavily on the work of Fei Li from Stanford University. This TED Talk is really worth watching, I think. So she says, well, in this rules-based way, we would say, let's teach the computer the rules for recognizing a cat. It's got two ears, a round face, chubby body, and a tail. So you could try and teach it that way. But how do you think it's going to go when the picture that it's looking at looks like this? Or like these? Or even like this? And yet a child can recognize all of those things as a cat immediately without calling on complex rules to work that out. Really, just based on their experience of having seen cats. So that's how things are now, which is training the algorithms by showing them numerous examples of something. So in this case, you show just off the internet the algorithm 100,000 pictures of cats, and you say, these are cats, please learn how to recognize them. And that's what they do. That's what it does very effectively. Trouble is, we've no idea how it's recognizing the cats. We don't know what, it's a black box. We just don't know how it's recognizing the cats. It's just like the child I was saying, they can learn to recognize a cat. Interestingly, with a much smaller training data set than 100,000 images, a few experiences of cats is enough for a child to learn that that's a cat. But again, the child can't tell us how they're recognizing it as a cat. And then there's moving into more complex areas of sort of unsupervised learning. Here there's a lot of pictures of cats and dogs, sometimes in the same picture, sometimes in separate ones. So instead of saying these are all cats, you might say, what sort of, to the computer, what patterns might you recognize in this? And by giving it some feedback with what it suggests, eventually it would say, oh, there's two different types of animals in these pictures. So there's this concept of sort of semi-supervised reinforcement learning, where you look at the output, make some suggestions, and it runs the algorithms again. So that's in the non-medical field, just to give the idea. So medically, here's an example. In the past, we tried to teach computers to recognize patients that might be developing this serious type of infection called sepsis. And we did that by teaching it the rules that we use. So doctors look at the patient's temperature, their heart rate, their blood pressure, some things in their blood called the CRP and the white cell count and the lactate, and try and assimilate that information to make a prediction when a patient might be becoming septic. The attempts to do that with computer algorithms were very poor. It was very ineffective. So the supervised learning method is to feed in all the electronic health and laboratory data from 100,000 patients. And we tell the computer which of those patients had sepsis as part of their final diagnosis in hospital. And just like with the cats, the AI algorithm learns to predict who might be becoming septic based on this vast array of data. But again, We don't know exactly how it's doing that, and it can't tell us how it's doing that. So this is in use in the real world. In the Parkville precinct, the big 4 hospitals in the Parkville precinct are on a electronic medical system called Epic. We use this for all our medical records and delivering information, storing information about patients. And they have algorithms, and they advertise them widely as stopping sepsis and saving lives. But those have been through a sort of independent analysis. A couple of years ago, somebody published a careful look at this and suggested that she wasn't doing a very good job. It missed the sepsis in 2/3 of the patients who had it, and had lots of false alarms, lots of false positives. Now, lots of people say, oh, well, this is just not going to work. I would say, that's 2 years ago. The way these systems are evolving, that is ancient history. It's very likely that these algorithms will improve to the point where they really can do this. But even if we go back to how it did perform, okay, it missed 2/3 of the patients, but it identified 1/3 of the patients. Now, supposing some of those were patients that the doctors and nurses caring for the patient would have missed, that's still potentially significant impact on lives saved. It would have been a problem if you replaced the current sort of clinical practices with the algorithm, but as a supplement, it may well still have saved people's lives. I thought we'd talk briefly about ChatGPT and its potential use in clinical practice. So, as most people know, it stands for Generative Pre-trained Transformer. I can see why they shorten the name. It's been one of the most sort of explosive developments in this field, and all it really does is it provides a text-based sort of interface, simulating a conversation between the user and the algorithm. And it came out in sort of public domain in November last year. In 5 days, had a million users and had 100 million users by January this year. And there's been a lot of talk, some hype, some real practical applications since. So what sorts of things might we use it for? Well, there's a very simple prompt I put in here, which is something I would do multiple times a week, write a letter for a child's school, in this case, giving advice on the classroom management of this girl's attention deficit hyperactivity disorder. I put that in just to see what it would do. And it wrote a better letter than I could have done, or could have done with the available time. Maybe if I'd had a couple of hours, I could have written a letter as good as this. It covered all of the things that we would suggest might be done in the classroom to help with this child's learning. And I would say, very high quality output. Then what about its use in helping us to make a diagnosis? So here I've suggested a diagnosis for a child who might have fever, rash, conjunctivitis, inflamed eyes, swollen lymph glands, and red lips. A common scenario in my work. And here it gave 12 possible diagnoses. The first one it gave is not at all common, but is by far the most serious. So in a way, it was very logical for it to suggest this as the first diagnosis, even though it's not very likely, it is very serious. So it's an important one to consider. And then we won't go through it in detail, but some of the things it suggested would fit with the features of this child, but not very well. And even then, it sort of qualified where it thought it might not be a very good fit, despite making the suggestions. Here's another example in which I've said, what's the best prophylaxis for childhood migraines? So children get migraines just like adults, and it came up with a number of preventative strategies, not just drugs. Some of the things were lifestyle modifications and so on, and some were drugs. And then I said, explain how they work. And it said, yes, we'll delve into how these work. And I've just picked a few here for some of the drugs. It gave very up-to-date understanding of how these medications actually work pharmacologically. So showing this to one of my colleagues, she said, wow, so it's just like Google on steroids. It pulls out the information from all the sources for you, collates it and summarizes it for you. And it's important to know that's exactly what it doesn't do. It is doing just the same as the algorithm on your phone. Every word in this thing that is presented back to us comes from a statistical analysis of what's the next most likely word to go in this sentence. Scraping from a huge amount of data that's on the internet and elsewhere. So it doesn't got any intelligence to collate and summarize. It's just doing this statistical trick of presenting the next word. And these are some of the sources that it's using. So a lot of stuff. This common crawl is just the general internet. It does get digital books and Wikipedia and things like that. But we have to remember the quality of information that's out there on the internet. I can tell you the chiropractic adjustments do not boost your immune system, but ChatGPT wouldn't know that. GPT-4 uses sources which are actually much more reputable and less likely to produce total nonsense. And there are now some specific generative medical programs, including one from Google. So back to the prophylaxis for childhood migraine. I suspect we'll hear more from Julian about this a bit later. I said, can you give me some references? And it said, sure, I can do. And here's the first 4 references it gave. But of course, the first 2 were completely fabricated. These references don't exist, even though they're presented with very high level of confidence by ChatGPT. These, again, were the results of just an algorithm trying to think what word might come next in this sequence. Interestingly, Microsoft's version of generative text AI, Microsoft Bing, actually does give you some of the references for the things that it's presenting to you, and they're reasonably accurate. I mentioned our electronic medical record program. There's lots going on in that space, in that the vendors are working with Microsoft, looking at how they might embed these generative tools in the electronic medical record. Maybe sometime soon I won't even type medical notes, because this sort of thing might be in place, what's called ambient clinical intelligence. I might be able to just sit with my patient in the consulting room. We have a conversation about their health care, and the system is listening and is able to differentiate the just social chit chat that we might have in there from the real medical core discussion, and actually produce a nice summary of the patient's history, which I can edit or approve. And then it might also suggest, well, you also usually order these investigations and prescribe these medications at the end of a conversation like that. So actually queue up things that I might use. You'd hope that the doctor would continue to use their brain, though, and not follow those instructions or the suggestions all the time. So in healthcare, just like elsewhere, there's this sort of spectrum of reactions to AI, from a panacea from every problem to it's going to be the end of the world. In this slide, I'm just conscious of time. I've outlined the sort of framework for us thinking about ethical problems in healthcare, trying to do good, trying not to do bad, giving some autonomy to the people involved and some justice and equity, and then layered on top of that, protecting confidentiality and thinking about regulation. I'm going to go just for a few more minutes to give a couple of examples of things in this area, and I've got more slides we can come back to later. So one of the things in this area of autonomy is, for clinicians, is this sort of black box effect. We talked before about having no real understanding how these tools are working some of the time. Are we comfortable using an intervention in healthcare where we don't really understand how they work? I'd have to say we've got lots of examples of that already. There are drugs that we use that are highly effective and we have no idea how they work. And there's multiple examples of that. So I don't think that should put us off. And then there's this concept of becoming overly reliant on the tools could it enfeeble us and reduce our clinical skills and reasoning skills if these tools are supporting us all the time. For me, it's a bit like the autopilot on a plane. Those are now very sophisticated and do all sorts of things to manage the path of a plane, including takeoff and landing. You would hope that if the system fails, that the pilots could still fly the plane. And there have been some examples of planes crashing when the autopilot failed and the pilots didn't know. Anyone due to travel sometime soon? Concept of transparency and informed consent for patients. You know, should we be telling our patients when we're using these tools in their healthcare? If I consult a generative AI program that look to consider a diagnosis in a challenging case, should I be telling the patient or their family that I'm doing that? I must say I don't tell them now if I'm looking it up on all sorts of other resources. So should I for this? Should they give their consent? There's an interesting thing published in the Boston Globe where they asked people in the community, how comfortable would you be about your doctor using AI tools to help in your healthcare? And something like 2/3 were indifferent. The next most common were people who were concerned or very concerned to think their doctor might not be using these advanced tools to help in their healthcare. They wanted the most modern healthcare available. And I'll maybe finish with this one. I can come back to my other slides later. One of the problems is the areas of disparity, I suppose. Firstly, well, for some of these tools, there might be issues of inequity of access, people in certain communities or patient groups not having access to the tools themselves or to doctors who might be using these tools, whereas white middle-class doctors in inner city suburbs might be using them. But there's also a very important point about the bias that might be introduced through the training data that was used. And that may be quite unrepresentative. And I'll just tell you a brief story and then I'll finish. So in the US, there's a healthcare organization that looks after 70 million US citizens. And they were recognizing that some of their patients they care for were ending up with chronic diseases, needing a lot of health interventions, costing a lot of money. And they thought, could we pick this up earlier? Could we pick up these problems earlier, intervene in some way, perhaps have nurses go and visit the patients at home, look at their lifestyle, check their blood pressure, check for diabetes and things earlier. So they developed algorithms to try and predict these patients and then ran a program that went 18 months or so trying to intervene. And the nurses, I think it was, who were going out to visit these patients said, where are all the Black people and the Hispanic people? We're going to visit, you know, we find ourselves, we're going to visit all these white people. And that really came down to the unrepresentative nature of the data. Sure enough, when you look back, it was predominantly middle-class white people who were having lots of healthcare and costing the system a lot of money. But that's because they had the ability to access healthcare and so on much more easily. All the disadvantaged groups, even though they're the ones who actually have more problems with those chronic health problems, were having trouble accessing healthcare and therefore not costing as much and therefore not appearing in the data. So that approach has now been discontinued. I better stop there and hand over to Julian, but there are many more issues ethical issues in my domain.
Thanks very much, Mike. Thanks, Julian, if you're happy to share your slides. Thank you.
So I think that's a really great, I guess, introduction into what I want, a lot of what I want to talk about, because I'm going to be focusing a lot on, I guess, large language models, things like ChatGPT and how they can be used. But in this case, rather than the medical contexts, by academics trying to decide whether and how to incorporate them into their own writing practices, and by publishers and by journal editors about what kind of guidelines they should introduce. So I put this together. The words are on my own. Artwork is generated using DALL-E and Stable Diffusion, the various versions of DALL-E. I did get a little bit distracted during Mike's talk because DALL-E 3 has just come out, and I wanted to see how it would go at giving instructions how to use an asthma puffer, which is on the surface very convincing until you realize that I don't think you do sort of insert the asthma puffer in that way into one's mouth. And the instructions where it has text says things like, you hold breath twice while rotating it, and then you breathe immolally. And then I played around some more, and I asked DALL-E 3 to give some instructions on how to apply sunscreen. And I'm not sure about the coverage on the left eyeball, but you know, it looks about right. And so the kind of technology here is very similar to the technology underpinning all kinds of generative AI, including text generation, and this worry about things that look about right, but actually don't make much sense below the surface is a big part of what I think we ought to worry about. So I think that's a sort of good lead in to the topic. So there are 4 things I want to do, and I'm probably going to skim over some of it quite quickly, but I want to give a bit of a sense of how we got here to the point where people are using ChatGPT, to the point that suddenly my colleagues and I are having a whole lot of students submit essays that we're pretty sure they've gotten ChatGPT to write for them. We're going to be having a look at some limitations of these large language models. We're going to be having a look at controversies in academic publishing, so rather than students among academics. And then I'm going to make some recommendations based on a paper that should be out any day now in the International Journal of Applied Philosophy. So I won't belabor this point. We've already heard that these tools are basically a kind of souped up predictive text. Predictive text on your phone, it will follow sort of 3 or 4 words you said before based on trends. It's identified across language in general at a pretty shallow level and some pretty shallow learning of how you write. GPT-2 back in 2018 was a souped up version of this. GPT-3 was a souped up version of that. And GPT 3.5 and GPT-4, which underpin ChatGPT, operate on the same principle. The one difference when you're looking at ChatGPT or Google Bard or other tools along these lines is that they have a chatbot interface, and a bit more has been done to shuffle, sort of coax them into giving the right kind of response. So in addition to the baseline model trained in this way, trained to predict the next word, the developers use some reinforcement learning where people would rate the outputs and thus try to make the models more consistent, thus try to make the models more polite, thus make the models try to appear more reputable and trustworthy, and to do something that the early versions never did, which was to demur from answering questions that it doesn't know anything about, to try to stop it from bullshitting. Now, as we'll see, it hasn't done this terribly well, but it is much better than the early models at not saying something completely false confidently. And it looks more plausible, it feels more trustworthy, they're more consistent. But also, because of this heavy layer of reinforcement learning, they've been shuffled toward this very specific style of writing. And if you've been interacting with it for long enough, looking at student essays for long enough, you get to understand, I guess, the kind of ChatGPT tone. It has a distinctive feel to it, and I think most large language models do, because of the way that they have been trained to usher them toward useful kind of outputs for, you know, sort of public consumption chatbot interfaces. But you don't need to just use the base models of any of these big language models. What you can do is you can fine tune them on a corpus of text that you provide it. And in that way, encourage it to write more in line with the style that you're feeding it, rather than the sort of existing set of associations that it's developed about, you know, what word follows what. And this is really great, because it used to be the case that if you wanted to try to get something to write in the style of Shakespeare, you would give it the complete work of Shakespeare, but then it can only learn so much about how language is meant to fit together based on the complete work of Shakespeare, and it would go wrong. Like, it just wouldn't have enough knowledge to produce much that's interesting. Here, it already has a pretty robust understanding of how language works and fits together, and you're using that existing understanding, and you're able to then apply this extra set of conventions over the top of it. You get to encourage it to write in certain ways, to worry about certain kinds of themes, and you can do this without sacrificing this existing set of language and vocabulary and knowledge that it has access to. And I found this really useful. So among other things, I've created fine-tuned versions for poetry. The poetry that it produces is just miles ahead of the poetry that the baseline ChatGPT produces. If you say, write me a poem, it's less bland, less boring, less predictable. And this has some pretty obvious applications in academic publishing. So here's a very recent paper published in the American Journal of Bioethics by Sebastian Mann and some colleagues, where they fine-tuned GPT-3, not even GPT-4, but GPT-3, on a corpus of publication text that was drawn from their own publications, both individually and together. And in this way, they made a applied ethics bot that performed much better than baseline ChatGPT or any other large language model in producing the kind of thing that they would publish and write about, and including in producing novel arguments and ideas. And so I think this is sort of suggests that these tools are more useful and will become more useful for academic publishing than we might give them credit for if we're just interacting with baseline ChatGPT and wondering why it's always so staid and boring and sort of predictable and repetitive. I want to point out progress can be rapid, progress can be unpredictable, current limitations might soon be overcome. Lots of history of this in technology. So Wilbur Wright announced it would be at least 50 years until heavy open air flight would be possible in a letter 2 years before he managed to achieve it. Also, OpenAI is in the early game in town. ChatGPT is in the early game in town. I mean, there's Google, but Google recently, it was recently a leaked document from Google in which some of the researchers there said that they think that the future, the most powerful models are going to come out of the open source community. There's a plethora of little projects doing similar things that they are going to outcompete Google and OpenAI sort of soon enough. That's how we got here. That's why they're promising. That's why I think we really need to start thinking about how to use them. They do have some limitations. There are worries about bias. These worries have changed over the course of the years. It used to be, back in the time of ChatGPT, the biggest worries about bias were on patterns of wording, like patterns of words that it learned from the training data. So given the kind of stuff it was trained on, it would tend to predict things like the black man worked as a pimp for 15 years, as opposed to the straight person was known for his ability to find his own voice and to speak clearly. There's some sort of very clear representation, things happening here, stereotypes happening here. This has been sort of ironed out through the reinforcement learning in ChatGPT, though it doesn't, to my view, eliminate the bias so much as create a different set of biases. So this is from Fox News, not a great source, but it does document something I'd observed, before myself, where it's very reluctant to criticize Biden, very reluctant to criticize, to say anything good about Trump, but very willing to do that for Biden. There's been some more research kind of trying to delve into the sort of biases you can find within ChatGPT output. It tends to be pro-environmental, pro-libertarian, pro-tech, maybe unsurprisingly, pro sort of technological solutions to social problems. I guess this is a kind of artifact of this reinforcement learning process. The bigger worry are about what's sometimes termed hallucinations. So as we've heard, it's not the case that these models will learn things from the text and then amalgamate them and output them to you. It will instead try to say something that sounds about right, given the question that you put to it. And it can sometimes get things spectacularly wrong, as in the case of a lawyer in the States recently who used ChatGPT for his research, then cited 6 non-existent cases in front of the judge. And, there's sort of repercussions because you can't cite non-existent cases that it had sort of hallucinated for it. My students, I'm pretty sure I've caught them using ChatGPT to summarize papers, and some of the details would be completely wrong. Sometimes they would give it the title of the paper, and it would infer what the paper was about based on the title and give them a summary, but it was about an entirely different topic. So it'd be really easy to pick that they had probably used it here. And this semester, I've let my students use AI without any restrictions, provided that they let me know how they've used them. And again, the students that relied on it the most have produced essays that get really central details completely wrong. Here's me asking ChatGPT to give ASCII art of an elephant. Here's me asking what it thinks of its elephant, and it ranks the elephant 7 out of 10. Here's Janelle Sheen from the AI Weirdness blog asking it to describe what the linoleum harvest Tumblr meme was about. Now, there's no such thing as the linoleum harvest tumbler-meme, but here's a really great history of it and how it is the various permutations of it over the years. Here's my attempt to get it to make a crossword for me with real words on every axis. So as you can see, it's a bit optimistic about whether endog is a real word or twaddle is a real word. But also, even when it lists the words below this little code output, it gets them completely wrong. So it says like 5 down e-logs when it's actually what I think is going wrong here is that what these models are producing is fundamentally bullshit. And there's some really interesting philosophical work on bullshit from Harry Frankfurt, which I've drawn in my work. So the idea is someone who's bullshitting isn't concerned about whether what they're saying is true or not. They are just concerned with appearing a certain way. And ChatGPT is concerned, insofar as it can be said to have concern, with appearing to answer the questions put to it without running afoul of anything that its reinforcement learning has said it shouldn't do. And this means that even though it sometimes says, I'm sorry, I can't answer that, if you ask it the right thing, like this ASCII art of an elephant, it can get things badly wrong. Bullshit can be correct, it can be incorrect, but the production of it is untethered from any kind of concern with reality, whether to lie or to tell the truth. So here are these tools, here's their benefits, here are some of the drawbacks. We've seen papers published with ChatGPT as a co-author already, but there's been some more sort of work trying to work out whether conceptually ChatGPT can count as an author, and the consensus now seems to be, no, it can't. It can't give final approval of work to be published in a meaningful sense, and it can't be accountable for anything that's said because it's not the moral agent. So co-authorship seems to be off the table. How about using ChatGPT in your writing? Well, there's a lot of worries about this, and there's this implicit assumption right through it. It's a really bad thing that ChatGPT is beginning to sort of make its way into publications, that it's difficult to detect, that journals might not be able to identify it. And there seems to be a sort of assumption here that it would be good if it weren't used, or if it were, the conditions of its use were very tightly constrained. So if you have a look at what different journals and publishers have done, here are the 4 categories. There are no restrictions. As far as I can tell, no one's explicitly said we're going to allow any use. You just have many journals that haven't updated their guidelines yet. They haven't addressed it. And so it's sort of de facto fully permissive. There are some publications that will require its use to be disclosed, some that will require its use to be disclosed and the nature of its use to be described, and some that will prohibit it altogether, like the science family of journals. The question I want to ask is which approach we should take as individuals, and I guess, you know, I'm part of journal editors and publishers. What should we be doing in response to this new technology? And that's where I guess the meat of this talk is. Even though this will be a bit rushed, it's sort of like, you know, this is the argument I've been developing over the publication I mentioned before that should be out soon. So if you have a look at some of the discourse around use of large language model output, you see a lot of attempts to draw analogies with other practices, and you see a lot of discussion of AI plagiarism. And there's a level on which this makes sense to me. It seems very akin to this thing we consider this grave academic sin, to copy paste something that you haven't written, put it in a publication, get credit for something that you haven't actually done. And if this analogy works, well, it would seem that maybe use of AI output is a form of plagiarism, maybe it's morally akin to plagiarism. But the question we need to ask is this analogy a good one? And it's really, you can't sort of, it's really hard to work that out just using the analogy itself. So it resembles plagiarism in one respect. You're sort of getting credit for something you haven't done, but there are other respects in which it doesn't resemble plagiarism. You're not appropriating anybody else's work. You're not claiming credit for something that another moral agent has done. So I guess, you know, sort of, the analogy can only get us so far. What I think we ought to be doing is, I think we ought to be taking a step back, and we ought to be thinking about, what are we doing as academics? What are we doing when we write papers? What are the goals of academic publication to begin with? I think the main goal, and the one we should really concern ourselves with, is that the reason we're in these jobs, the reasons we're reading things and then writing about them, is to produce useful knowledge, to make contributions to debates. Whether this is empirical knowledge or my own areas in philosophy, philosophical argument, we're trying to go contribute something to the areas of thought that we're intervening in. We're trying to build on them. We're trying to produce knowledge that will have some benefit somewhere down the track. And if we think about what we should do as academics and how we should set our publication norms, I think we should look at how well different kind of norms and approaches will serve this fundamental goal of producing useful knowledge. So plagiarism, I don't think it really serves it. Occasionally you can have somebody plagiarize something and then bring a new idea, shine a spotlight on some interesting idea by publishing something that's been neglected for the last 50 years, say. And that's been done before, and that has some kind of benefits in terms of bringing new ideas back to light. But there are many much more significant drawbacks. It introduces an efficiency into scholarly research. So you extract the ideas that you plagiarize from their existing critical context. You can't see from a plagiarized work what have other people said about this before, how have they responded, how does this relate to the author's existing body of work and kind of body of thought. None of that's possible, and that sort of retards like the ability to work effectively with this plagiarized text. At the same time, people who successfully plagiarize get extra prestige, extra sort of job opportunities, extra academic influence on the basis of skills that they lack. And so there's a kind of misallocation there that I think is a bad thing from the standpoint of the goals of academia. But this doesn't really apply to large language models, because there's nobody else who deserves the prestige. There's no existing body of work that these ideas belong to. There's no existing critical context in which the AI output has come. It's been generated fresh by ChatGPT. But does large language model use serve the goal of producing useful knowledge? Well, I think it can. If it's used carefully, it can introduce genuinely valuable new ideas, which is what the MAN paper that I mentioned before found when they fine-tuned their applied ethics spot. It did produce genuinely valuable arguments, ideas that hadn't occurred to them before. And I think that's great, and we should welcome it when it does so. It can make our work more efficient in all kinds of respects. For my part, I've not published anything in which I've replicated text written by AI, but I've used it to write early drafts, realized they're terrible, but I struggle writing early drafts, so then I've rewritten it, and it's made my work a bit more efficient. It can aid in clear communication, rewriting, writing particular styles. Having said that, we have these worries about bullshit, chunky arguments, inaccurate information, inaccurate summaries, and I'm really sort of grateful that Mike already mentioned this because I'm almost out of time. They can make up citations, and these kinds of errors can derail debates when citations are missing or work is mischaracterized, and areas of thought end up being dismissed because someone's criticized it on grounds that are poor grounds because they actually reflect a misunderstanding of what happened in the original study or paper. This stuff can be awful. This can push back, like this can really interfere with the ability of academia to do its job. And this is a real risk when it comes to use of generative AI. So I think it's good for idea generation, idea interrogation, writing tasks, drafting, even producing arguments and ideas of entire articles. It's bad for, well, wholesale adoption of output without interrogation. And you might think, who would actually do this? Well, if you search for as an AI language model in Google Scholar, you will find plenty of papers that have done this and have included in the text of the journal article as an AI language model because they have copy-pasted it and it hasn't been reviewed appropriately. So some people are doing this, and that is awful, and we shouldn't. We shouldn't use it to pepper our own work with citations. So a lot of people are recommending this. A lot of people are excited about how it can make this part of our jobs more efficient. We don't need to find the citations ourselves to back up what we're saying, but we have a responsibility to make sure that what we're saying is tethered to things that have actually been published to represent others' work accurately, to represent the facts or sort of previous findings accurately. And it can get things wrong, and we need to take responsibility for it. We shouldn't use it to summarize work we haven't ourselves read carefully and haven't verified as interpretation, because again, that can introduce inaccuracies into the scholarly record and derail debates. So I think we shouldn't block or discourage uses of generative AI that promote the goals of academia. So these kind of good ones, I think we should allow them and we should not discourage them. Disclosure requirements might discourage them because it's much less prestigious, I think, to publish a work that an AI bot wrote for you than to publish something where you're responsible for the thinking, especially in a field like philosophy, where I'm from, we're sort of really prized for like ability to commune with reality and have new insights. But we should protect against careless uses. We should try to avoid chunky arguments, biased arguments, misrepresentation of others' work, and citation of sources not actually consulted. Do we need new guidelines for this? Well, I think we need a strong rejection of these problems of like misrepresenting others' work, of citing sources one hasn't actually read and verified. But it's not clear to me that this is an AI specific problem. And you can see this recent book published shortly before the release of ChatGPT document all of these cases where these problems have derailed academic debates where humans have been responsible for them. So I think it's sort of an open question whether it's we need something AI specific or whether we just need to try to prevent these problems in general. I'm out of time, but I'm just going to say whatever I'm saying here doesn't necessarily apply to student essays because the goals there are different. We're wanting to test knowledge and probably shouldn't use AI if we can actually prevent them effectively. Whereas writing a journal article, it's not about showing that we're good at something. It's about contributing to discourse and sort of the norms there. They're therefore different. We can split these things apart. And that's it. Thank you.
Well, thank you very much, Julian and Mike. That was really fascinating. It raises lots and lots of interesting questions that I think people are grappling with. Thanks both to Mike and Julian for bringing along in the talks people who know a lot and people who don't know a lot, and sort of helping everybody to understand some of the issues in this space. Please join me in thanking our presenters. We're really grateful to you for a great presentation. And we've just popped in the chat if you are not currently on the Health Law and Ethics Network mailing list and would like to join. There's a link there that you can follow so that you can receive information about future seminars. But thank you very much to both our presenters today.